The Wall Street Journal Editorial Board had a very interesting piece about President Trump's most favored nation prescription drug policies. The political race for fewer cures. Trump's MFN, most favored nation price controls on drugs, will harm U.S. companies and patients. We all understand the motivation here. It is absurd that Americans are paying so much more for prescription drugs than people in Europe. Part of the challenge there is Europe has instituted price controls where they say we're only going to pay this much for drugs, and Americans have ended up having to foot the cost. One thing that the Wall Street Journal points out is this could have been a great opportunity to include in President Trump's recent trade deal with the European Union and Japan and other countries. They declined to do that. So the Wall Street Journal raises a number of concerns about this policy. First, it misses the mark on what's actually driving healthcare costs. The biggest driver of healthcare costs is hospitals. Medicare and Medicaid spent 3 times as much on hospitals as they did on prescription drugs in 2023. Patient out-of-pocket spending on prescription drugs accounts for 1% of U.S. healthcare spending. One other issue that doesn't get a lot of attention is the very tight controls on the patent system for drug companies. So a company might make a lot of money when they create a new drug that's groundbreaking and has incredible results, but their ability to control the patent on that is very short by law. So within just a few years, other companies are coming in creating generics and similar drugs that drive down the costs for everyone. That is the market at work, and it works much more effectively to lower prices for people than price controls. There's also huge concern about China. Right now, China is racing at breakneck speed to try and take over America's dominance in the biopharmaceutical market. China has a lot of built-in advantages. The fact that the government is basically funding the building of this entire industry. The fact that they can rapidly test their biopharmaceutical drugs on their population because their population doesn't have any kind of freedom or anything like that. Now, as China is trying so hard to take this over, people have to consider, do they want the country that unleashed the coronavirus pandemic to control so much of the drugs that they will eventually rely on, both for day-to-day issues, but also the cures they're going to rely on to fight diseases for years to come? I think that the Wall Street Journal has raised a number of important points here that the administration will continue to consider as they drive this policy. If you like what you're seeing from the 10-Minute Drill, subscribe on YouTube. We have full episodes twice a week and clips every day going through the most important stories you care about.